Alright everyone, in this video I want to talk about 6 advantages that skeletal expansion of the mandible through Dr. Yousefian's DAME procedure, distraction assisted mandibular expansion, similar to MSDO, mandibular symphysial distraction osteogenesis, basically splitting the chin in the mandible in half and skeletally expanding the mandible. I want to talk about 6 advantages that this procedure has over simply doing dental expansion of the mandible alongside maxillary expansion using an appliance like the MSE or Dr. Yousefian's Main or Doan appliances, which are also both maxillary distractors. So, just a little preface. For all these years, or at least the last 3 since we've been talking about MSE, we've all been wondering, what do we do about the lower? I've posed this problem. Every person that I consult with through a one-on-one chat, jawhacks.com/chats, everyone asks me this question. So if I'm expanding my maxilla, what am I going to do for my mandible? Duh, common sense, right? And my answer to that question for all these years has been that, well, you tip the upper teeth in and you tip the lower teeth out. You basically use dental compensation, dental movement, tooth movement, to get the upper and the lower to match following skeletal expansion of the maxilla. And so that was never really sat well with me. And in my own treatment, that's what I have been doing. I've been doing dental correction of my bite following MSE expansion, but it was never quite right for my audience and for me personally. It was just not an adequate answer. You just know, right? I mean, there's so much common sense that goes into jaw hacking, and dental expansion to match skeletal expansion is just, there's an asymmetry there. Now, having interviewed Dr. Yousefian, we know for a fact that skeletal expansion of the mandible is superior in these concrete ways. Number 1, when you expand the mandible skeletally, that allows you to expand the maxilla more with MSE. So rather than being limited at X number of millimeters in the maxilla, you can now expand the maxilla as much as you expand the lower, that much more. So if you can get 6 or 7 millimeters of skeletal expansion on the mandible, you can expand the MSE that much more than you otherwise would have, because tooth movement has limits. And also, facial aesthetics have limits. We're going to talk about the balloon face problem shortly, but basically, if you expand the maxilla too much without expanding the mandible, you get this weird aesthetic where the mid-face and the top half of your face starts looking wide and the chin stays narrow and it looks tapered like a balloon. Not a good look. I've seen it. And it's just, you know, it's not someplace you want to be. And so that's why I'm frequently telling people you have to really moderate your MSE expansion unless you're doing skeletal expansion of the mandible. Second reason why you can get more skeletal expansion out of the maxilla if you use mandibular expansion such as DAME is because you will hit the coronoid process of the mandible if you don't expand the maxilla. This is something I learned in my interview with Dr. Yousefian, link in the description below. And I actually experienced this, and I never really knew what the answer was as to this pain that I felt during my own MSE expansion, which caused me to stop turning the appliance. Basically, I was at 84 turns of my MSE, and I started feeling, actually on the left side, the side that expanded more for me, I started experiencing this sharp pain right here. And I had to stop turning the appliance, and I had to actually turn it back down to about 80 turns to make the pain go away. Well, now I know that what happened was that I was hitting the coronoid process of the mandible with my maxilla. Now, if you, in squeezing tissues and compressing them, causing pain. If you expand the mandible, though, you expand the coronoid process out a little bit, and you can avoid hitting that wall. So, second reason why expanding the mandible skeletally with the dame alongside MSE expansion is good. Second reason, it improves the airway. This is huge because so many of us go into MSE treatment for our airway. Where, even those of us who are interested in aesthetics, we know that aesthetics and function, form is function, or to say the least, form and function are two sides of the same coin, two wings of the same bird. They go together. When you expand the mandible skeletally, you lift the hyoid bone. You lift muscles and other soft tissues that are in your pharyngeal airway. And that pulls them out of your airway, and it gives you sleep apnea correction. MSE gives you nasal expansion, it gives you oral volume, gets the tongue out of your throat to some degree by giving you more space transversally to bring your tongue up and forward and side to side. But it totally doesn't do jack for the pharyngeal airway, except for getting the tongue out, but it doesn't do anything for the hyoid bone, for the muscles behind, in and around your tongue, and the other tissues in that area. And, so some people are doing MSE, or some people will even do double jaw surgery, and they will still have slack tissue in their pharyngeal airway, and they'll go see someone like Dr. Kazarian, who's an ENT, who does these special sleep apnea procedures that specifically lift and bring forward and then tie these tissues in the pharyngeal airway that the mandibular distractor, when you widen the mandible, it has a little bit of that effect. It brings those tissues a little bit up and forward, and therefore has a positive effect on sleep disordered breathing, which is a tremendous, tremendous advantage. Third reason why skeletal expansion of the mandible is awesome is because it prevents dental relapse following MSE expansion that is caused by tension in the buccinator muscles. I learned this as well in my interview with Dr. Yousefian. The buccinator muscles they go up and down, more or less, and they're right in here. And so when you expand the maxilla without expanding the mandible, you're creating tension in the buccinator muscles. You're essentially creating a rubber band that has an elastic force. And that elastic force wants to come back to center. And in its memory of coming back under tension, it's going to apply force to the teeth of the upper, but especially the lower. And it's going to collapse them in, which is going to reduce oral volume, and it's going to pose challenges to the occlusion. Because remember, when we expand with the MSE, the upper teeth are already getting wider than the lower teeth, and so the last thing we need is additional force on the lower teeth to bring them in and to collapse them and make them narrower than the maxilla. And so this is a direct issue with SFOT, surgically facilitated orthodontic therapy, which some people use to complement maxillary expansion to make the lower equal the upper. Basically, you're doing bone grafts and corticotomy on the lower teeth and then expanding them out. It's essentially bone graft assisted, corticotomy assisted dental expansion of the lower to get it to match the upper. But then you get this because you're not moving the mandibular bone, you're getting this tension in the buccinator muscles that's going to suck those SFOT expanded lower teeth in and essentially counteract that that dental expansion that you just underwent that brutal bone graft procedure to accomplish. So mandibular skeletal expansion through DAME or MSDO is going to be superior to SFOT for that very specific reason. Fourth reason why mandibular skeletal expansion is advantageous, especially alongside skeletal expansion of the maxilla through MSE or similar, is because it prevents the balloon face aesthetic. The balloon face aesthetic is not a good look. And I've seen it many times where you expand the maxilla a shit ton, but the mandibular bone doesn't expand, and so this part of your face right here remains narrow, or the way it was. This part of your face, the midface, the zygomas in the maxillary arch, gets wider. You get a tapered balloon look. And it's not a good look. It's a funny look. And I've had many people, complain to me about the effect that the MSE has had on their aesthetics. And I think that when people are unhappy with the way MSE makes them look, they're specifically referring to the asymmetry that occurs in the width of their midface and the upper half of their face in general with respect to the lower half. If you could just do some skeletal expansion of the mandible to complement that widening of the midface, those people would probably be not so insecure and upset about the effect that the MSE has had. Essentially, skeletal expansion of the mandible helps reduce or eliminate the balloon face negative aesthetic effect that the MSE can have. Next advantage of skeletal expansion of the mandible, it's faster. It's faster. What do I mean by this? Moving teeth is super, super, super slow and frustrating at how slow it is, and it's painful. And it's unhealthy, which is going to be the last advantage, number 6, as we'll see. Less dental movement means less resorption of bone, gum, and roots of the teeth. But let's talk about speed for now. When you can just expand the bone 1 turn a day, or whatever it is, you're getting, a millimeter per week of real skeletal expansion of the mandible. Do you know how long that would take to achieve dentally? Months. It's probably a whole order of magnitude faster. So that's an advantage, because it just means as an adult who, none of us want to be in orthodontics. None of us want to be in braces or Invisalign, or like I'm in Brius, which is why I talk funny. I got all this metal in my mouth on the lingual side, which is to say on the inside of my teeth. It sucks. Anything we can do to accelerate our treatment, to cut treatment time down by months, is a huge advantage. When you go right to the bone, you skip the dental movement, you're shortening treatment time. And this segues very neatly into the last, number 6, the last advantage that I can think of skeletal expansion of the mandible, which is you're doing less harm to the teeth, and therefore less harm overall. On the surface, dental expansion, like SFOT, seems less invasive than skeletal expansion, because you're not seeing, the orthodontic surgeon, you're not getting your bone cut with a saw, although with SFOT you are, in the corticotomy part of that procedure. But people think tooth-borne expanders are less invasive than bone-borne expanders. That is just bullshit. It's bullshit. Whenever you apply force to the teeth, you are doing irreparable damage that cannot be reversed. I know, because I've had tooth-borne expanders. So when you can skip the tooth-borne expansion and go right to the bone, you are saving yourself a huge amount of harm that's being done to the roots of your teeth, to your alveolar bone, and to your gums, which will all start to resorb under orthodontic pressure. Orthodontic pressure is what it takes to move teeth. Orthodontic pressure is always a double-edged sword. It's a guarantee that applying orthodontic pressure to teeth, especially expansively, pushing them outward through the alveolar bone rather than side to side, pushing them outward is specifically and exceptionally bad for them. So you can skip most of that when you do DAME or MSDO. You can get all that expansion skeletally and avoid months worth of huge amounts of orthodontic pressure on the teeth. Now, that was 6 advantages I could think of after my interview with Dr. Yousefian to expanding the mandible. If you can think of others, please post them in the comments, because this is by no means an exhaustive list. Maybe there's other things I haven't thought of, so post them below, and we'll go from there. This is a community effort to find answers to these questions, and y'all are smarter than me. So, and know more. I mean, I learned most of what I know from, consulting with you guys and from comments. So please chime in below. Don't forget to like and subscribe. And I hope you enjoyed this interview with Dr. Yousefian as much as I did, because he really, how should I put it? This ushers in a new chapter in jaw hacking as far as I'm concerned. This paradigm of expanding the lower with the upper takes us all to the next level. Dr. Yousefian has corrected a fundamental flaw in the prior approach that we were all using, which was MSE and then dental correction of the asymmetry between the upper and lower. By introducing to us the opportunity to do bone-borne expansion of the mandible, we have leveled up. So, talk to you all soon. Be easy. Peace out.